All right. Hello, everybody. We're going to go ahead and get started in about 1 minute. We're just letting everybody in. As you may know, my name is Daisy Cardenas, and I am the workshop coordinator for this year's Mi Futuro virtual workshops. So just hang in there for about 1 more minute, and we'll go ahead and get started. We have such a treat for you all today. I'm really excited for you to see what we have in store. All right, so let's go ahead and share the screen. So today we're going to do it a little different. Usually we play the heart map video. However, because we have such an awesome presenter who wants to show you a little bit more about the work that he does, we're going to skip it and we can go back to it later, or you can always find this video on our YouTube page, Mi Futuro. So this is our team: Lucetta, who's the co-founder, Navi, who's a community physician, and then me, I'm a grad school student. Thank you all for being here. And we're going to skip this one. And as you may all be very familiar with this, chart that we have put together, all the healthcare careers from a semester to 2 semester longs to advanced practices. And today we're going to be talking about a career of somebody named Stan Jacobs, who is a surgeon. And we're going to be learning about his career path and any insight that he can give any students that are interested in pursuing this career. But as you know, we've talked to EMTs, we've talked to CNAs, we've talked to dental assistants, we had a pharmacist, somebody public health, we had an MFT, and we have a nurse practitioner coming up next week, which I'll talk a little bit more about in just a second. But for now, I'm just going to hand it right over to Stanley Jacobs. Stanley has been a champion in the Mi Futuro movement. He has been a volunteer and provided workshops over many years with us, and we're very excited to have someone with so much experience that is always willing to give back and share their stories with our community and our youth. So I'm going to go ahead and just pass it on. And Dr. Jacobs, feel free to take it from here.
Hi, everybody. Can everybody hear me, I hope? Yeah. Okay, so my name is Dr. Stan Jacobs, and the last few years I've been doing this with Mi Futuro, and it's very excited to be here. And I'm in my office in Healdsburg, and Hillary, who works with me, is here to help. I'm in a room upstairs, our consultation room, with a table with some stuff, props and things I'm going to show you in detail in a bit. But I do facial plastic reconstructive surgery. I'm upstairs. Downstairs is an operating room. I'm hoping that I can actually show you the operating room a little bit later and what my office looks like. So my history is I was interested in kind of biology first, and then I went into in undergrad, and I did anatomy and immunology, and I wasn't really sure what I wanted to do, but I knew like the medical or biological sciences. And then I went and did a master's in immunology. This is actually in Canada, in Toronto, where I trained. And then I thought that was cool, except I didn't want to hang out with mice all the time. So even though I got to publish in a medical journal called the Journal of Immunology. So then I went into medical school, and after medical school, I then got into general surgery and actually open heart cardiovascular thoracic surgery for a while in training. And then I switched from that into facial, plastic, ear, nose, and throat, and reconstructive surgery. So I did stuff on children who were born with defects of the face and neck, and then I also did adult work, of course. Surgery. And so I've been practicing in Sonoma County for just 30 years, just over around 30 years. And I practiced in, in Santa Rosa for a long time, and now I'm in Healdsburg. I have my own surgery center here in Healdsburg, which I'll hopefully show you a little bit more of later. It's 5,000 feet. There's 2 floors downstairs. Thank you. I was given some water. So what I'm going to do is when we were able to meet, it was a lot different. I could kind of show you stuff, general medical things like things that test your reflex and the doctor bag stuff. So, what do we get kind of thing, stethoscopes, and we were having you listen to your heart and lungs, each of you, and kind of, just sort of general medical stuff, tuning forks, stuff like that. But because we're not meeting and it's not interactive that way, unfortunately, I'm going to be more of showing you things. So are we ready to go?
Mhm.
So the first video, I'm going to show you some different videos. I'm actually just going to hold the computer up to the bigger screen. Hopefully you can see that okay and hear it okay. So a lot of you know, obviously COVID's been horrible for a lot of people, a lot of problems health-wise and financial-wise and everything else. Anyway, in the beginning, back in March, actually March 31st, I did a video on YouTube that was to show, how you get the swab in your nose to get a COVID test. And it was supposed to swab the nasopharynx. Well, you probably don't know necessarily where the nasopharynx is. Well, don't be alarmed, because some nurses and doctors aren't really clear where the nasopharynx is, because that's where the virus sort of lives. Now there's some different nose, but at this time the nasopharyngeal swab was required. So I'm going to show you a video that I did. Show patients about the nasopharynx, because with the COVID virus, people are talking about doing, of course, nasopharyngeal swabs. You can do oropharyngeal swabs and nasal swabs, but the nasopharynx is an area that a lot of people don't know about where it is exactly. Some of this dark hole, like Indiana Jones is the treasure at the end, but how do you get through the cave? So this is a drawing of the nasopharynx made simple. So we call it NP for nasopharynx. This is a cross section of the face. So this would be the eye, the outside of the nose. This is the inside of the nose. This is your tongue, and the chin, of course, would be here. What you want to do if you're going to do a swab is to go straight back into the nose. So this is the opening of the nose. You don't want to go up. There's sensitive structure called nasal turbinates, and they'll bleed and get swollen quite a bit. So you want to go straight back. So you have the patient's head straight. I'm going to demonstrate that on my nurse in a minute. And then the nasopharynx is this box area at the back. So when the Q-tip hits the back, the swab hits the back of the nasopharynx, you'll know when to stop. And then, of course, you can withdraw it straight up. So go straight in, straight out. Don't have the head tilted. So if you're swabbing somebody in a car, in their car, and you're standing there, and you're a nurse or a practitioner, and they're sitting there against the headrest, don't have them do that. If they do, you're going to have to come in at an angle parallel to their head. So this side here shows the outside of the nose, the nostrils, the nasal tip from below. You'd be going into here. This is the inside of the nose. This is the nasal septum, which is cartilage, has lining mucosa, and the nasal can bleed a fair amount. And of course, some people will have a deviated nasal septum. So maybe their septum is bent like this. If you're going to put the nasal swab on this side, if you go in gently along the floor here, if you hit the structure, then you should stop and just try to go to the other side instead. And if the septum is deviated this way, you'll have a lot more space in this side to go into. So just go along the floor of the nose and make sure that you don't, if you hit something hard, just switch to the other side. Let me show you, come on in, Jenny. I'm going to show you what we're going to do here. So this is obviously it's all sterile technique. We wear masks and gowns, but we're not doing that. It's just to show the anatomy today. And there's a double swab, but we're just going to take one out just for the sake of demonstration. And then, so here's her head has to be straight like that. And you want to go into the nose like this, but you don't want to go up, and you don't want to go out to hit that turbinate, and you don't want to go inside. So if you look towards the camera, Danny, so you want to go straight in and all the way in. You don't want to go up. You don't want to hit the septum. You don't hit the turbinate. You want to go straight in along the floor of the nose, and the floor of the nose would be right about parallel to where the bottom of the tragus is, which is this part over here, the bottom, near the bottom of the ear. So that's your trajectory, except straight in, and then straight out again. Thank you. Okay, so that gives you an idea of what I was teaching, and a lot of the nurses are using the doctors to know how to do that. In fact, multiple hospitals around the Bay Area and then the California Nurses Association were using that video to show that. So that's one video. And so what I do is, again, as a facial plastic surgeon, I do surgery, so I do facial surgery, I do elective surgery, which is like facelifts and eyelid lifts, nose jobs. This is sort of gives you an idea of somebody that I did surgery on before and after with a facelift. That's 2 weeks after a facelift and an eyelid lift. So this is the kind of stuff I do. Or this is a lady who's a year after. So it's called aesthetic surgery to make them look more youthful, more healthy, get them healthier skin. This is with a chemical peel and a facelift. So if somebody has skin cancers or precancerous skin cells, you can actually make that a lot better with a chemical peel. But if you guys are younger, you know about sunscreen, and if you wear sunscreen, you're not going to end up with skin like that or many skin cancers. Then there's some people where nobody knows what happened to their skin. They just sort of develop, unfortunately, this sort of pigment going on here. Nobody knew why she got that, and she was quite distraught, had to wear a ton of makeup to try to cover it. And the picture on the other side is her after I did a chemical peel called TCA, trichloroacetic acid, TCA, a year later. So it kind of can change somebody's life by doing that kind of thing. And then again, some more cases where somebody has sort of a heavier neck and jowl area, and then I do that surgery. We do general anesthetics here. We do sedation downstairs. Again, if I have time, I'll show you the operating room. And that kind of surgery takes about 2 to 3 hours to do it. And recovery time is about, a month. And then here's another lady that sometimes will do a facelift and then nose surgery. So I did some work on her nose, kind of was a little crooked and kind of fixed the tip a little bit. So I sometimes will do other procedures at the same time. And then there's some people who just, usually younger women. I got a lot of those who want their nose fixed. So this young woman, her nose is kind of a little sticking out, a little dipped down. I lifted it a bit, made it a little smaller. And then there's somebody like this who had kind of a bump, and that's about a year later and kind of made the tip a little bit better. We can kind of see that difference. So again, a lot of the work I do is aesthetic surgery. I used to do a lot of reconstructive surgery for the face for cancers, but I don't do as much of that now. But I also did some interesting things that I'll show you. I used to do masks of people's faces because I was looking, doing work on their nose, and I was had to give a talk in New York about nose surgery, and I was going to take side view as I was doing different parts of the surgery to see if I did this the procedure, how it would change that part of the nose. And then I decided, why like a mask of a person's whole face. So I started doing that in surgery. So this is actually a mask of a woman that I did surgery on, or this is before surgery. This is just when she's just going to sleep. And I drew on like little pink lines. You can see where the cartilages at the top of the nose here, bones here, and then I drew on like kind of a little bit marking at the nasal tip. That's where the cartilage is at the tip of the nose that shapes the tip. And this is her. It's going to look a little weird. This is the same person partway through surgery. So you can kind of see that looks a little funny because she's got this sort of, dip here. That's because I took down the cartilage of the septum. I hadn't taken down the bony part. I used a little chisel to take that off, but it just shows you what it looks like in surgery part way through. It looks a little weird, but that's sort of how it looks. And that she was asleep at that point, of course, she wasn't awake. And then this is her 6 months later after the surgery. So this is her before, and this is her after over here. So you get a sense of what somebody can look like if you change their nose in a sort of a three-dimensional way. So that might give you a little insight into what happens a bit into surgery. And now we're going to look at another video. In fact, this is a young lady that I did a rhinoplasty on, and this is her just 1 week after surgery. I just took the cast off her nose. Okay.
Yeah, that's it.
Yeah, that's it. Really good.
And also your bones were really wide.
Yeah,
So if I narrowed that and didn't do anything there,
would have just been,
it would have been not.
yeah, that was perfect.
So, yeah.
Thank you so much.
Yep.
So you can play with it next as soon as you're ready.
Well, then I'm probably neither.
Okay. Or whatever, yeah. So that was a patient who had nasal surgery, and that was just a week later. She's got a little bit of bruising here, and she had like a plastic cast on her nose, which so I put this plastic cast to kind of help conform it after surgery. And then there's a few stitches under here, because what actually happens that I'm going to show you right now is that I make an incision when they're asleep, of course, and lift the skin of the nose up so you can see all those cartilages I was showing on the mask, and how I work on the nasal tip and what that looks like. So in fact, here's a patient, good timing there, Hilly, that, okay, play it. I think you can.
This is the lower lateral cartilages. This is the side that's been untreated where the curve is very flat. There's not much of a curve. This is the right side, which I did a suturing technique to make domal definition better. And you can see how the height is better, things are better on the treated side.
Oh yeah, maybe you can see it. So hopefully you get this, you could see that a little bit. Anyway, that's the inside of the nose. Everything else is kind of covered up. Anyway, go ahead and play another one too. So that's a patient that had, again, to show the anatomy of the nasal tip, the incisions here, the skin's lifted up so I can work on the nasal tip. Okay, I can always show that one. So that's called rhinoplasty, and then I'll show you some pictures of also facelifts so we can get them too, where there's that for a facelift, the incision goes around the sideburn. I don't have any hair here, but if I had sideburn, and then around this little thing called this piece of cartilage, and then goes behind the ear into your hair, into the hair, and then I pull underneath the face and put stitches inside in the fascia underneath, because our bodies are made of layers. So there's skin, of course, envelope, there's of course a skeleton and muscles, but between all the organs, between arteries, between and between muscles and nerves, there's planes or levels, like envelopes, and these envelopes are called fascial planes, open up. And when you're doing surgery, whether it's the abdomen, chest, or face, you get into these layers and they open up. And if you're in the right player or plane of dissection, we call it, it's going to be a bloodless surgery, because there literally opens up in a bloodless field. So that's ideally what we want to do. We want to get in, as a surgeon, you want to get into the tissue wherever it is, and do your work as though you were never there. And that just takes a lot of experience and understanding about anatomy and how you can make the surgery work. And then you get less swelling, less bruising, less complications with nerve injury or anything else. So, and here's a patient now that I'm going to show you about a facelift. So it looks a little weird. So you're going to look, it's her right ear. There's an incision around the ear. We lifted the skin up, and she's asleep on the operating table. Yep, perfect. So what I'm doing, that's my hand there. That's called a needle driver. And I'm sewing the fascia, which is the connective tissue, in the face to lift up the loose tissue underneath. And that you can see the suture. I'm tying a knot there to lift that up. And then, so the incision around the ear, this is the skin being lifted up. And so this is her right ear, her nose and mouth are over in that direction. The top of her head's over here. So I'm coming in at that angle and putting stitches to lift the fascia layer up. The nerve that moves your face, called the facial nerve, that makes you animate and close your eyes and open your eyes and everything, is underneath this. So that's at a different layer or plane of dissection, we call it. So the nerve that moves your face actually has 5 branches called the facial nerve, ones that do all this and all that. That is deep to what's called a parotid gland, which makes saliva here. And then it comes up superficially more closer to the skin to move all the muscles of your face. We call those mimetic muscles, meaning like movement. So, and then you ready? Mm-hmm. Okay, then here's another one, kind of similar kind of case. And you can see with my left hand, I'm pulling the tissue up. My right hand, I've got the needle driver. The nurse is retracting. The tube is in the patient's throat, so she's asleep. It's a general anesthetic. I've actually done an eyelid lift on her too, but we tape her eye shut so we don't injure the eye by accident. And then that layer that you're seeing that's sort of glistening in here, that's the fascial layer. Maybe you can get closer. That helps. I don't know if you can see that well. So anyway, those stitches that I'm putting in will dissolve a few months later, but it doesn't matter because then it's all going to be healed, and the tissue that I lifted up has a blood supply. So the key thing in surgery is you always want to have tissues have a blood supply. And so you want to lift the tissue, and if it's still attached, that's called a rotation flap. So you rotate it and move it into another position, but it still has an artery. Here's another patient that I did surgery on, and I marked it with a pen, blue marks, and if you can see those marks there. And now I'm removing some tissue that was redundant, extra tissue called the fascia. This is called the SMAS fascia. And that could be thrown away. We don't need that, it's extra tissue. But below where my scissors are is the nerves and the gland that makes saliva. So you have to know all the anatomy, obviously, of the face to stay away from these little nerves and things that travel throughout here. And as you can see, it's really,
How the fuck did you?
there's really not much blood in there. So as you can see, there's no bleeding. So it's kind of interesting that way, if you do it right. And here's another lady, kind of a similar procedure, lifting that up. So let's see, I'm just going to check on the time. Yeah, so we just got a few more minutes, so that's fine. I'm just going to finish up by showing you the other thing that I've done is I created a skincare line called the Stanley Jacobs MD Skincare, but it was based on a surgical papyrus from Egypt. And what I've done is I've got the actual papyrus here, and this is hieroglyphs here in Hieratic, and this is the English version of that papyrus, and it's written 4,000 years ago. The Edwin Smith papyrus is 4,000 years old, and it had a recipe for transforming an old man into a youth, it was called. And I found that back in the year 2000, but it took me 8 years to decipher what was in the actual chemical formula. So it's actually chemical formula. The rest of the book is about surgery and trauma after trauma, battle, axe wounds and hatchet wounds and war. And they did reconstruction for the chest and abdomen, really advanced 4,000 years ago. But they also had something to make skin better and smoother and tighter. So I actually, with some partners and cosmetic chemists, resurrected that formula and created a skincare line called Stanley Jacobs MD. And we did some scientific studies on it to measure skin elasticity, and it increases skin elasticity 25% in a month. We actually have a device called a cutometer. It measures the skin elasticity, is accurate to 1 micron. So we did a lot of science behind it and produced some products. And then from that, I actually wrote a book called Nefertiti's Secret. And the book is about the whole history of the Egyptians formula and how we sort of resurrected the formula and sold it on Home Shopping Network. And now a company actually is interested in buying our company. So as a side project, it's been kind of interesting to develop something. So always be thinking, always be expanding your mind. You never know, how did I know that an Egyptian papyrus would develop a skincare line to help people's skin and then, make some money. So always be adventurous in your education and challenge yourself always. That's important. 2 minutes, I'm just gonna, you wanna say bye?
Bye.
That's Hillary. I'm going to walk downstairs. Hopefully the connection will stay put, and I'll show you the rest of the office. So here's the upstairs. There's the waiting area. There's kitchen. There's exam rooms. And then downstairs. And then this is the entrance through here. And so this is actually when people walk in, they see this. My office is in there, it's kind of messy. And this is the operating room. And we have 2 unlikely people. No, just kidding. Say hi. There's Rob and Danny. Where are you? There you are. So this is the operating room, where we do surgery. So behind Rob does anesthesia. Behind him is the anesthetic piece of equipment to put people to sleep with. And so that's where the gas goes. He's holding up the gas mask that you probably see on TV and all that. He's getting himself a little something. And then Danny's the one that assists me in surgery. And this is the operating table. We play music. And we have all precautionary things, like if something bad happens to somebody, we can fix those things. So anyway, that's the talk. So maybe I can answer some questions.
Yes, thank you so much, Dr. Jacobs. That was definitely very interesting to learn of all your accomplishments and how you were able to create that skincare line and write a book about it. So your accomplishments are definitely very inspirational. So now I'd like to open it up to the students to ask questions. Now feel free to raise your hand or send me or just drop your question in the chat. Or you can send them directly to me. So we have about 4 minutes for Q&A. So please feel free to ask questions. And I also have some questions that were submitted ahead of time. So I'll let the students do it first. If not, I'll ask the questions. So anybody can ask a question. Okay, let's see. Someone raise their hand. Ricardo. Okay, Ricardo, please go ahead and unmute yourself and ask your question.
Hi, I actually am thinking of becoming a surgeon in the future. I want to be a neurosurgeon. So I was just wondering how, how you organize your time as like a surgeon, because I've heard, I feel like I've heard a lot that, it can be a really stressful job because, it's like a lot's going on. So I was just wondering, how you organize your time.
Well, I mean, organizing my time, I'm not sure that's a big question, but in terms of like you want to be a neurosurgeon, I did neurosurgery as well in my training. I love neurosurgery, actually. I worked with this very famous aneurysm surgeon in the Circle of Willis, which is if you look up Circle of Willis, maybe you know about it already, but a lot of aneurysms occur there. Anyway, neurosurgery is a phenomenal field. That way people can go, it's not like it's neurosurgery, and you go, yeah, it is. But it's very cool. It's again the same thing after internship residency in which is 4 years, could be 3 years, depends of neurosurgery. So it's a fair amount of work. Surgery is the kind of thing where you have to do a lot of cases. It's sort of a numbers game. You got to do a lot. It's like you want to go to a surgeon, no matter what he or she specialty is, that does a lot of things. So that's why I only specialize in faces, because I only do a few procedures, but I do thousands of them. I've done probably 12,000 facial surgeries. So it's a lot, but that's just, that's my specialty. So that's why being a brain surgeon, is obviously a huge time commitment. It's going to be different than mine because like I don't work weekends. I don't work after hours unless somebody has a problem and calls me. But neurosurgery, you don't have much time to yourself. You're on call a fair amount, and obviously people are quite sick. But you can do some amazing things for people. It's very rewarding, and it's a very cool field. In terms of time management, you're going to figure that out. The first thing you got to do is get into med school, work through that, and then read a lot and study neurosurgery.
Thank you, Ricardo, for asking that question as well. I do see there's another hand up, but I did see a message in the chat. And I'll combine these two questions. How long did it take you to become a cosmetic surgeon? And what was your education process like? So I know you mentioned it at the beginning, but maybe talking about like your undergrad and then the process after that.
Yeah, for me, I took kind of a longer road, so I don't want to bias people, but I didn't know really what I wanted to do. I went into undergrad in biology and kind of morphed into anatomy and a little bit of immunology because I wasn't sure. I knew I liked sciences, so that's what I did. And then like I mentioned, I went and did a master's in immunology because I wasn't sure if I wanted to go actually into medicine or be more of a scientist branch, going to go PhD side versus sort of MD side. But after doing that, and I worked at a really great institute, I realized I needed to be with people. It wasn't something I wanted to work in a lab. So that's when I went into medical school. So now when I was in medical school, I realized that, when you get to medical school, you kind of divided almost, you could tell almost immediately people who want to go kind of in medicine versus surgery. And I was more the surgical bent. I'm an active guy still today. I mean, I do a lot of stuff in mountain bike. I do these things. I travel around the world. I give conferences all over the place. So I'm pretty active, and surgeons are kind of that kind of person, get stuff done. And try to come up with new techniques, and experimenting with things and suture techniques and what have you. So it just me a long time, but again, it's when you talk about medicine, and so I have a foundation of science, which everybody needs as a doc, and then you go into actual medicine, and then it built on that as different surgeries I did, and then it kind of got into my specialty surgery at the top. So I can rely on lots of different things I've done, seen, and practiced, and to put it together. So it's like anything in life. You're going to take interesting thoughts and ideas that make you who you are by all the knowledge and the experiences you've had. And never think that studying too much is too much, or never working too hard is too much. It's all going to come to you in spades later in your life, because you're going to rely on those experiences and things you read and worked hard at. It's going to really help you in the long run. It's going to make you a better person. It's going to make you a smarter surgeon, a smarter person, and a better doctor, whatever field you're going into. So it took me, well, to give you a number, I think it was like 16 years after high school, or something like that, 18 years.
Great, thank you so much. And then the last question we'll take will be from Penelope. Go ahead and unmute yourself.
Hi, thank you again for coming to talk to us, by the way. I'll make it quick, but I also want to pursue neurosurgery. So I do have a question about the curriculum in medical school and just the prerequisites to be able to apply for it. Math isn't, I'm not really that good at math. Is math very important in becoming a surgeon?
Well, a little disclaimer. I mean, it's been a long time since I had to apply to medical school, so things might be different. But so I don't know much about how to apply. But in terms of, at this point in my career, is math important? Actually, for me, it is, because I still publish papers, scientific papers. And I just published one on that skin elasticity study, and I was using statistics and data to calculate, non-parametric statistics and rank sum tests and things like that to compare, with the treatment, without the treatment, and before and after, that kind of stuff. So it's not like I use it every day. And what I do, it's more geometry, if you will. I mean, measuring and moving and doing that kind of stuff. But I mean, I don't use calculus, or anything like that. I have an interest in math myself, but unfortunately, you have to do calculus to kind of get into, I'm pretty sure, still into medical school. But it's not something you would do every day. But you need to have some mathematical background to understand statistics and analyzing data, because that's what you're going to do. You read any scientific paper, they're going to give you some data, and you're going to need to analyze that yourself, because don't believe everything you read, even if it's in a medical journal. You want to analyze that data yourself, cross-reference it with other articles, and see, hey, these people, what they're claiming they said was happening, in the conclusion, is that supported by their results? And that's something that you're going to be able to do.
Great, thank you so much. So that wraps, don't leave yet, y'all. I have just one more announcement, but thank you so much, Dr. Jacobs. It's been a real treat to have you come back.
My pleasure.
Speak to our students. So round of applause, muchas gracias. We appreciate, and we hope you can join us again next year. So now,
hopefully we'll be in person.
Yes, hopefully. Let's work towards it. But I'm just going to give a couple more announcements. Now, as you see, the poll is up. Please answer it. I'm going to go ahead and share my screen. I muted myself. Talk about next week. So next week we have, we're going to be reviewing nursing careers, and Mayra Reynosa, who's actually a good friend of mine, will be talking. She recently started She graduated, I think, within the last couple of years, and right now she's working at Marin Health Medical Center, but she's also worked at Sutter. She's a nurse practitioner. So please, same link, register and attend. Remember, it starts at 12:40. If you could log on at like 12:36 or something, or 37, we could get started a little sooner. And then someone did ask this in the Q&A, but all these videos that are being presented are also being uploaded to our YouTube page. So if you missed it, or if you want to tell a friend about it, just look us up on Mi Futuro. Lastly, please answer the poll. I see there's like 11 of you who haven't answered it. Please answer it. And check out our Facebook page and our Instagram. Show some love. We need more likes. We want more follows. And it's great to have you all here, and thank you for continuing to participate. If you have any questions, please send us an email at mifuturonorcal@gmail.com. But thank you all for participating, and we hope to see you back next week. Bye, everybody.